Hi, I'm Kristen Giannone.
And I'm Ashley Batista.
And today we will be talking about depression and anxiety and how we as counselors can help combat these issues in a school setting. First, I will cover the issue of depression found in children and adolescents. Depression has become an extremely prevalent condition found in children of all ages. Children as young as 3 years old have been found to now be experiencing depression, meaning there is a need for counselors even at the preschool level. As far as for adolescents, one study actually found that 20 to 50% of adolescents self-reported feeling significant levels of depression, which is an extremely high number when looking at the grand scheme of things. As a counselor, our job is to find the source of these conditions, which many times is set off by a negative life event that the child or adolescent is currently experiencing. This can include things like environmental issues or chronic conditions, which have been linked to depression. For examples, issues within the family, bullying, or even dealing with a developmental disorder can be the onset for depression. Finally, it is also important for counselors to know that this issue tends to be more prevalent in females than in males, with the ratio being 2 to 1, respectively. So what can make a person more susceptible to depression? One study found that certain personality traits such as neuroticism or viewing everything in a negative light can make a person more likely to suffer from depression. Research has also found that there is a genetic component to depression, which one study found to be moderately inheritable. As counselors, this is important to know since it is likely that this will run in families. Another factor that plays a role in depression is cognitive vulnerability. Things like self-criticism have been proven to be linked with depression, which is an issue that CBT would be really effective in focusing on. Finally, it is important to note high comorbidity rates that depression has with other conditions, such as anxiety, ADHD, or even conditions like autism. The symptoms found in children and adolescents for depression can actually be quite different than what you would find in an adult. Some common symptoms to look out for are things like irritability or moodiness, a student having difficulty with peer relationships, the child no longer enjoying or doing well at activities they used to be excited about or excel in, the child being isolated or withdrawn from family and peers, a decline in grades and academic performance, a lack of focus or concentration in class, and possibly even showing little care to their outer appearances. Additional symptoms found in children and adolescents can also include things like them being lethargic and possibly sleeping through class, tardiness, consistent sadness, and even can include increased dropout rates. Cognitive behavioral therapy has had a significant amount of research supporting its effectiveness for treating depression in children and adolescents. CBT's general domains to focus on and understand when dealing with depression are the affective, cognitive, motivational, environmental, physical, and cultural domains. The next 2 slides are charts from a study I found focusing on specific cognitive behavioral techniques used by a therapist that were found to be effective. The chart shows reliability coefficients for the effectiveness of each specific technique, as well as examples of things the therapist would say for each one. Some of them were attending to the client's experience, presenting oneself as an ally to the client, and presenting positive expectations about change. Other techniques used by the therapist were exploring the student's motivation for change, cognitive restructuring, praising the student, structuring sessions, and being supportive to the client. By looking at this chart, you can see the different levels of effectiveness for each specific technique. Finally, I will talk about one other study I found that uses cognitive behavioral therapy and relaxation groups in a school setting to treat depression. Moderately depressed students were assigned to one of 3 groups: the CBT group, the relaxation training group, and the control group. Students received 50-minute sessions 2 times a week for 5 straight weeks in the high school setting. The CBT group focused on techniques like self-monitoring, self-control skills, and social reinforcement, which included homework, goal setting, and cognitive restructuring. The relaxation training group focused on relaxation skills such as relaxing different muscle groups. Overall, both treatment groups were found to significantly reduce depression when compared to the control group that received no treatment. These groups also ended up improving other conditions such as self-concept and anxiety. Since anxiety is commonly experienced in conjunction with depression, Ashley will now talk about anxiety in schools.
Anxiety is one of the most prevalent mental health problems amongst youth. There are 3 different forms: generalized anxiety disorder, social phobia, and separation anxiety disorder. Generalized anxiety disorder can be described as excessive anxiety and worry about a number of events or activities that the child finds difficult to control, interferes significantly with day-to-day living, and is accompanied by physical symptoms. Social phobia can be described as a persistent fear of specific situations in which embarrassment may occur. Children typically avoid social or performance situations. Separation anxiety disorder is described as at least 4 weeks of excessive anxiety concerning separation from the home or from those to whom the individual is attached. To conduct a school assessment of anxiety, there are multiple methods and informants that can be used. Some of the methods can be interviews, report inventories, or behavioral observations. Some of the informants can be the child, the teacher, or the parent. One should address anxiety across cognitive, behavioral, and psychological components. One should also assess the child's skill deficits in areas of emotional regulation and social interaction. The triple vulnerability model has 3 components that all contribute to anxiety. The first is general genetic vulnerability. The second is general psychological vulnerability, which concerns a sense of impending, uncontrollable, and unpredictable threat. The third is a specific psychological vulnerability, which results from early learning experiences that lead a child to experience anxiety in certain situations. To begin the process of using interventions in the school for students who have anxiety, counselors need to use repeated and prolonged exposure to the feared objects, situations, and events. Interventions include instruction in the 4 following areas: somatic, cognitive restructuring, problem solving, and contingency management. A cognitive behavioral intervention for somatic reactions to anxiety help a student to learn to identify individual somatic reactions to anxiety. It helps the student to learn various cognitive and behavioral strategies that in the end decrease the amount of somatic reactions a student experiences when they are feeling anxious. Cognitive restructuring interventions include cognitive techniques that are designed to modify the maladaptive nature of anxiety. Counselors can teach their students how to do this through the use of countering anxious thoughts by using self-talk, rational analysis of thoughts, and learning how to use coping thoughts. Oftentimes, students need help with understanding how to solve their problems. For a problem-solving intervention, counselors can help their students control unwanted behavior or initiate coping behavior through the mediation of covert thinking processes. There are 7 steps in the problem-solving process. Step 1 is to recognize existence of a problem. Step 2 is to define the problem in a goal-directed manner. Step 3 is to use brain efficiency. Step 4 is evaluate potential effectiveness of alternatives. Step 5 is select the best alternative. Step 6 is implement the chosen solution. And step 7 is to verify the effectiveness of the chosen solution. In terms of using contingency management interventions, counselors need to help their students understand the antecedents and consequences of their behavior. To follow up with this, they need to discontinue the reinforcement for maladaptive behavior. There are many different tools that counselors can use when they begin their interventions for students who are dealing with anxiety. Counselors need to provide opportunities for students to practice their coping skills, exposure to using the coping skills in the school setting, and they can do this through the use of group counseling or classroom guidance lessons. There is one intervention program that has already been used, which is called the Coping Cat. The Coping Cat is an intervention program that can be used for children and adolescents who have anxiety. The program can be refined to be more time-effective and efficient for school-based interventions for students who are dealing with anxiety. The sessions of the Coping Cat intervention program that can be used in the schools are as follows. The first session should be an introduction to the program. The second session would involve effective education. The third session would involve identifying somatic cues for anxiety. The fourth session would be psychoeducation and normalization of the anxiety response. The fifth session would be relaxation training. The sixth session would be cognitive restructuring. And the last and final session would be problem solving, developing a plan to cope with anxiety.
In conclusion, even though anxiety and depression are separate disorders, oftentimes students will experience symptoms of both. Counselors should be aware of the comorbidity of these disorders.